Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, where the AMGA public policy team dissects all things healthcare so you don't have to. That's a tagline written by Miss Latney over there, who's smiling because not only did I use it, but I was required to use it.
There's a little bit of smugness, a little bit of satisfaction here, and a little excitement. It sounds good when you say it.
Well, I hope so. It's interesting. Diva 1 and Diva 2 are the ones that give the outlines. Diva 2 is to my right also. Well, speaking of...
Didn't use my tagline last week.
I did too. Well, let's introduce everybody.
That was a weak defense.
Yeah, sorry.
Like, moving on.
Diva 1.
Hi, I'm Lauren Latney, Director of Government Relations at AMGA.
Hi, I'm Daryl Drevna. I'm the Senior Director of Regulatory Affairs.
AKA Diva 2.
Yep.
Jamie Miller, Ambassador of Goodwill, and I'm just there, the sun, and I'm just here.
There's the sun.
Revolving around.
Sounds something.
Alicia Sawyer, Government Relations Assistant.
Who is secretly complaining because she and I have to share a microphone. But that's the way it is. You know what? Before we start, I have a question. What is your favorite Transformer?
Oh.
Because we were talking about that earlier. We need, what's it called? Patreon? We need Patreon to see the behind the scenes podcast crew.
Behind the fine print.
Mm-hmm. Oh, that's very good. Transformer? Favorite? Anybody?
Bumblebee, just because he doesn't talk, and he's just funny.
He talks.
Well, no, but in the movie he doesn't talk. I mean,
I'm
talking about the movie.
You're talking about the movie. I'm going back to the 80s cartoon where Soundwave is clearly the best Transformer.
I like the Transformers that keep the power running at a concert. I think that's what they're called, right? Or is that transponder?
It's all good.
Yeah.
I'm a little out of my depth on this question. The only Transformer I know other than Bumblebee is Optimus Prime.
Sounds good.
There you go.
Okay.
Because I don't know any of these guys. All right.
What were you doing in the 80s? You weren't watching cartoons? Oh, you were like...
He was older.
You were playing rugby and like talking on your personal phone line.
I did not. That's right. 301-652-3168. Mm-hmm. All right. Well, those were the days, by the way. Life was good. Okay, so let's talk about...
No digital footprint back then.
Thanks be to God. Okay, so today we'll be discussing the CMS Rural Health Transformation Program, which by the time we air this podcast will have closed their application program. CMS is expected to announce awardees and initial funding allocations by December 31st, 2025. And again, this is fully scripted. Today we'll unpack what this transformation program actually is, why it matters, and what may happen next in terms of the future of rural health. That's a teaser.
Well,
It sounds good.
You're supposed to put your hand in your chin when you see that in the note. Yeah.
You know what? Well, I have bursitis in my elbow, so I can't.
Okay.
Don't be 60, y'all. Okay. Well, Alicia, you're next.
All right. I'm happy to give some background on the program. So thanks, Chet. As it's scripted, I say thank you.
What a wonderful leader you are. Thank you so much.
Thank you.
I do like that. The sun over here.
The Rural Health Transformation Program was created under the One Big Beautiful Bill Act that was signed into law by President Trump in July of this year. The goal of the program is to stabilize and strengthen rural hospitals and providers, and the program appropriates a total of $50 billion from fiscal year 2026 through 2030 to the 50 states. 50% of the $50 billion, $25 billion.
That's good.
key improv on that.
Yeah, ad-libbed.
That's you grad right there.
Of the funding allocation will be divided equally among states that submit an application to CMS, and the remaining 50% will be distributed to states based on a formula developed by the CMS administrator. The law requires the CMS administrator to consider a state's rural population, proportion of healthcare facilities in rural areas, and situation of hospitals that serve a high proportion of low-income patients. Assuming all 50 states apply and are approved, each state would receive at least $100 million per year for 5 years.
All right. Well, thank you, Alicia. So, Lauren, I look to you. A lot seems to be riding on this state application. Can you talk a little more about what needs to be in that plan?
Yeah, we've been hearing a lot from our GR council meetings when they were talking about like trying to get their applications ready. I think some of them were like having their own little working groups to talk about this. So in order, when you're submitting your plan, which I think is due next week, November 5th, the rural health, it must describe how the state would use the funds for the program. And you must use at least 3 of the following criteria, which is 1, like either improve access to hospitals, other healthcare providers, and healthcare items and services furnished to the rural residents of the state, improve healthcare outcomes of rural residents of the state, prioritize the use of new and emerging technologies that emphasize prevention and chronic disease management, initiate, foster, and strengthen local and regional strategic partnerships from rural hospitals and other healthcare providers to promote measurable quality improvement, increase financial stability, maximize economies of scale, and share best practices in care delivery.
That's a lot.
It is a lot. That's a lot asking.
Mackerel, geez Louise.
Right. And enhance economic opportunity for and supply of healthcare clinicians throughout enhanced recruitment and training, prioritize data and technology-driven solutions that help rural hospitals and other rural healthcare providers furnish high-quality healthcare services as close to the patient's home as it is possible, outline strategies to help manage long-term financial solvency and operating models of rural health hospitals in the state, and identify specific causes driving the accelerating rate of standalone rural hospitals at risk of closure, conversion, or service reduction.
That is a lot.
So that's asking a lot of the states.
And that's, so you have to do 3 of those, 1, 2, 3, 4, 5, 6, 7, 8
Yeah.
criteria. Okay. Gosh, and our GR teams were working on that.
They're working.
As we speak.
All the states are part of our GA councils are working on it, and it'll be interesting to see if they put the state plans out for us to look at them, because
Right.
I am curious. I think the number one thing I'd be was like, how do you just keep this hospital open, not the other amazing criteria that you're asking these hospitals and providers to do already.
It does sound like a CMS application, doesn't it?
It does. I watched the webinar last week, so it was.
Oh, and he is ready to go.
Yeah,
I think the rest of you are out. Daryl is in, but according to the script that Lauren gave me, it's actually Jamie's turn. But we'll get to you. You watch,
His bow tie is just
You
going
watch-
around in circles right now. So angry.
and we knew you'd watch the webinar.
Yeah,
And we thank you for your service.
no problem.
All right. So, Jamie, according to what Lisa just said, each state that applies for the program has the potential to get $100 million over the next 5 years. That sounds great. That's a lot of money. But in context, the OBBBA took a lot more out of healthcare than this $50 billion program put it in. Can you talk a little bit about that?
Yeah. I guess we'll call it OB3 now. Is that good? OB3, OBA, OB3.
Not the Working Families
Working-
Tax Cuts Plan.
Oh
Act.
Yeah,
They
there's a lot of different-
rebranded.
But yeah, I think you mentioned it. You put all this in context. It is a little more complicated. $50 billion is a great victory for hospitals, and hospitals and providers. But if you think about it, this OB3, it passed the House and this earlier this year, but the problem was trying to pass the Senate. And there are a lot of senators who are voicing opposition to some of the Medicaid cuts in the Republican Party. And so one could argue that this $50 billion account helped win certain senators support the bill. But what is not being said is that the OB3 cut over $900 billion out of the Medicaid system that is going to impact all patients. So yes, $50 billion is great, but compensating for the $900 billion it took out of the healthcare system is not as sufficient. So
you're saying that almost $1 trillion is a little more than $50 billion.
yeah, I didn't major. I didn't major this.
Okay.
I did
Now
not
that's
major.
math.
I did not,
Took math in 1982, and that sounds good.
But and when we were advocating on these Medicaid cuts, we were talking, and thanks to all the AMGA members, were helping us explain the impact of these cuts, because really what these Medicaid cuts do is it restricts access. 10 million people less will have health insurance because of this bill, and when that happens, it means that less people will have access, but also our facilities, our members are going to have to potentially close clinics. They're going to have to reduce providers and clinicians. So it has more of an impact on the general population, not just Medicaid. And so we will be talking with AMJ members in the coming months and years about Medicaid cut survey results, and we're going to be doing a new Medicaid cut survey. So we really appreciate your. But interesting with the rural angle. I also think, I remember one of our members testified for a Senate Finance Committee, and we learned that every senator considers their state to be rural. So that's probably why this was called the Rural Transformation Program. But the problem was that not everything that's impacted by these Medicaid cuts is rural. There's a lot of underserved areas in certain parts, certain states. But according to the USDA, between 2005 and 2023, 146 hospitals in rural counties have closed already. And that's problematic. And we're already reading news of other facilities closing. If not a system, maybe clinics in a small town. If they have two, potentially the system closes one. So that means that the patient has to drive a lot longer ways to get access to care. So we're going to continue this fight and talk about the Medicaid cuts. And a lot of these cuts are implemented after the election in 2026 midterm, but we're going to be talking to members and letting them know that AMJ members are suffering and their patients are suffering because of this.
We had a Medicaid cuts campaign this year, and we're actually going to beef it up in a very major way for 26. And look forward to working with all of you to alleviate or eliminate many of these cuts that Jamie just mentioned. Okay, so I'm looking at Daryl.
No.
He's very excited. There's a whole page of Daryl coming up.
Of course, it's deep
Yeah.
too. I was like, as I was writing the outline, I was like, well, I got to give Daryl some more. Yeah.
That was very
Right.
generous of
Yeah,
you.
there's
Yeah,
one,
I
two,
actually just have there's just a space for him to improv. Like he doesn't. This is his show now.
Yeah, no, I'm ready. I don't know why y'all are still.
The amateur hour is over.
What are the cool kids called? You're going to riff?
Yeah. Oh, yeah. Here we go. What do you want to talk about? Like, all the questions I've been getting about this, like how you fill out your application,
How to be an Eagle
That
Scout.
sounds good.
how to be an Eagle Scout. My son, he's 2 badges and a project shy, so almost
Good
there.
American right there.
I'm starting to appreciate why they have the "I survived my son's Eagle Project" T-shirt. So, but in a lot of ways, it feels like the same way for the states here. The number one question I get is from our members, like, how do I apply for this program? And and I have to tell them, oh, you can't. It's not, the states are applying, right? So it's, and that caused a whole lot of confusion among, the provider community. They thought, oh, is this something I can apply for? It's like, no, it's the 50 states, and I should note, DC and the territories aren't eligible. So you got to move to Virginia or Maryland.
Wow.
If you're in
Seriously?
DC. Yeah. See, look right here. It says,
The webinar.
in the webinar.
Yeah, which you
DC,
were on, no one else
which
was.
exactly.
Right.
It was, yeah.
He didn't mention the webinar to any of us either, did he?
Oh, he's dedicated there. Wow.
Really? No. Wow, that's...
He's trying to make himself invaluable.
Right.
DC it's information. Information is power. Right?
So true.
It is actually.
Shared.
I thought knowledge is power.
That's wrong.
That's the ABC. Don't do drugs.
Yeah. So our members have a vested interest in the states applying for these programs, and to date we haven't heard of a state not. There's no reason for a state not to apply. Deadlines, closing as we speak, essentially, and it really comes down to the application itself and how the states what they can do. It's in some ways it's really prescriptive, but in a lot of ways it's really vague, right? They've got these broad, like transformation of care delivery, improved access, expanded enhanced services. That's like, well, what does that mean? So that's gonna be what the states are gonna detail in their application. And there are some parameters, like, can the states use this to, sort of make our members a little bit whole because of the cuts Jamie was alluding to in a way, like, can you pay providers with these funds? Yes, but up to 15% of the funds in a given budget year can go to, providers. What about upgrading your electronic medical records? Yes, but only 5% of those funds can go to that. Otherwise, it's enhanced services. So the states are going to have to detail in their application what exactly that looks like. And CMS is going to have a lot of discretion on, whether they approve those, use of funds for that particular purpose or not. So we're sort of in a wait and see. And to Lauren's point earlier, I anticipate that these applications, anytime there's a state Medicaid plan amendment, those all get posted online. Those are all public. So I anticipate that these applications are going to be available at some point. Presumably the government will be open, because I tried to do a little bit more looking into this, and the website's down because the government's closed. So
Is it really?
Yeah. So that could be a little bit of a wrinkle here. So hopefully there's someone at CMS to actually review these applications with the time frame we're talking about here.
All right. And there was some discussion around the Trump administration's push around AI.
Yeah. So I think, there's a whole lot of focus on how the Trump team is really interested in this. You can, if you wind back a little bit, like that's the whole Wiser model. We're going to use AI in the prior auth space and all that. Are they going to use AI to review these funds? Are they going to want states to have AI as part of their application process and how these funds are getting distributed and used and that sort of thing? Or, if you're talking about these technological and infrastructure investments, it's a pretty broad category. Mm-hmm. And if you can only cap, if you capped your EMR at 5%, well, that leaves a whole lot to potentially be used for, using some sort of AI program or platform in how these funds are used, or how you're using that to, support the rest of this, funding scope, transformation of care delivery, improved access. Now, how AI plays into that, I'm really curious to see these applications and how they're proposing to use that sort of technology and the funding with it to, achieve these policy goals.
All right. Well, that will be interesting. I mean, we have a lot to wait, to December 31st to see a lot of the applications and some of the responses and all those sort of things. So we have a lot to learn on New Year's Eve.
I think so, right.
So you'll be working.
Absolutely. Absolutely.
Of course you will.
Yep. It'll be fun, I think.
All right. I'm glad you think so.
Yeah, but it really, our members, how do I get, how do we access these funds? Because I think the bigger problem is what, Jamie was talking about. They're seeing this as a way to sort of backfill some of the cuts.
Right.
And then, the way the program's set up, it's got to go through the states first.
All right. Well, great. Any other final thoughts around this from the team?
Yeah, if your state has applied, please just let us know. Just give us some information and background. I think this is helpful for all of us. I know I've been talking to some member offices. Even though the government shut down, staff are still meeting with folks, and they were talking about their states applying for these funds, and also what are they going to do about provider taxes and everything else next year. So this thing is ongoing. The Hill is interested in this. So it's important to also be sharing this information with us so we can also amplify your voice on the Hill.
And that's a great point. As someone said, information is power.
There you go.
Give us the information, and we will make sure that it gets to the right hands.
And Medicaid policy is not as partisan as one would think. So just if you're from a certain state that is very dependent upon Medicaid, those are the states where you need to be talking to your senators, your governors. I also had a question about AI. Daryl, how do we certify that this is not artificial intelligence right now?
Are we in a simulation right now?
Yeah, I am not a robot. We just click the button, or
you're talking about, are we passing the Turing test? Is that the
is this an AI generated presentation? Are we real people?
There's not enough glitches.
Yeah.
It's pretty clear this is not smooth.
Just checking.
Yeah.
Alicia, wrap it up.
Please reach out to us. We can be reached individually if you have our emails, but we can also be reached at publicpolicy@amga.org.
I thought you were going to say, please help me.
She wrote that on the side. We can't read.
There was a plea for help. Yeah, we saw that. Okay. All right. Well, thank you, everybody. Appreciate it. And for all of our listeners, hope you all have a very nice day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.